Chronic traumatic encephalopathy, otherwise known as CTE, was first discovered in the brains, post-mortem brains of several football players who had committed suicide. 33 former football players have now died as a result of CTE, and unfortunately to date, they can still only diagnose it post-mortem in the autopsy. And they're working on being able to diagnose it in living people, so of course we can prevent an unnatural demise. The symptoms of CTE include irritability, depression, short-term memory problems, disorientation, poor judgment, anger outbursts. You can see where some of these symptoms would affect quality of life greatly and relationships, more importantly with family members. Now, they haven't come up with a treatment in the conventional model for this. They're researching it, and there is a website that you can go to that if you feel that you have the symptoms of CTE, that you can join this group and be part of that research group. And as far as treatment, there's no medication. Of course, CTE sufferers are often put on psychiatric meds, antidepressants, Xanax, that type of thing. And I'm a naturopathic physician, so of course our perspective is CTE was not caused by a lack of Xanax, and we want to treat the cause. The cause of CTE is inflammation in the brain. What happens is with the repetitive blows that an athlete receives, football players, soccer players, boxers, it was first known for this, it had a different name. However, boxers have long known to have these symptoms of CTE. And the repetitive blows cause the blood-brain barrier to be more permeable. It's supposed to be very sealed up, very tight. It becomes more permeable, allowing the influx of autoantibodies. This is causing inflammation in the brain, and the hallmark sign in the post-mortem brain is the accumulation of tau proteins in certain areas of the brain. That's what they're finding during the autopsy. As far as naturopathic medicine, we are really good at treating inflammation. We treat autoimmune disease all day long very successfully. So again, autoimmune disease in the conventional model is treated, they treat the symptoms of the autoimmune disease with corticosteroids to suppress the inflammation. We want to treat the cause of inflammation. So as far as CTE, the original event, of course, is a series of blows to the head. And unfortunately with CTE and also with the symptoms may not show up for years after the events, the blows to the head. And so that can be confusing because it's so many years later, but we know that now. And however, that it did happen in a young high school football player who died shortly after his last concussion. And this was on top of subconcussive blows that he had received repetitively. And it was after that homecoming game, and he died. So that happened, the onset of symptoms and death happened very quickly. Most of the time, pretty much all the time, it's years later that you're having these symptoms. And in naturopathic medicine, we use supplements to decrease inflammation. We use diet. The inflammation can disrupt blood flow, can disrupt hormonal imbalance, and can disrupt neurotransmitters. So starting with neurotransmitters, the friendly guys, GABA, serotonin, we don't want to run short of those. Now, of course, again, the psychiatric meds will address that, but they come with side effects, addiction, and they can actually throw you more off balance. Replenishing the neurotransmitters through supplementation can be more successful, long-lasting, no addiction issues, no side effects. GABA, again, serotonin, all of these, we can push those pathways and increase your own endogenous production of those if you're not producing them in sufficient amounts. Testosterone and progesterone are known to be anti-inflammatory hormones for the brain. Hormone replacement therapy is definitely appropriate when it comes to CTE. Definitely appropriate. Again, quality of life with the testosterone and progesterone plays a big role in decreasing anxiety, promoting deeper sleep. Memory, testosterone plays a huge role in memory loss, brain fog. Progesterone decreases irritability. These we prescribe day in and day out in naturopathic medicine. And with the diagnosis of CTE, it's perfectly justified to prescribe those if you're running low on the blood tests. And so with all of our tools that we have to offer, and the conventional model still researching what medication they're going to come up with, I believe that naturopathic medicine offers a promising outlook for the sufferers of CTE, the disease is incurable, but as far as treating the cause, the inflammation of the brain, the out of balance neurotransmitters and hormones, and proper behavioral modification, which even Mayo Clinic has, that's basically the treatment that they've come up with so far is behavioral modification. Those three things can improve the quality of life, improve the relationships, decrease or eliminate the symptoms of CTE.